Hi, welcome to this episode of Meet the Therapist. And my name is Dr. Kelly Donohoe. I'm a licensed psychologist here at Magnolia Psych, and I love my job. I would like to talk a little today about what is therapy, how does it look, how could it possibly feel, and why would I do it? So those are some important questions. One reason that lots of people seek therapy is because they're feeling any kind of way that they don't want to be feeling anymore. So whether that's mood or a change you'd like to make in your life, something you'd like to see different, you're working through a transition, maybe there's an aspect of your identity that is unfinished or unsettled that you want to work through. There can also be concerns such as depression, anxiety, any of the mood disorders, or any type of mental health diagnosis. It's always a good time to seek therapy for that. If your family isn't working just quite like you'd like it to, you can seek therapy and we will non-judgmentally help you through that process. Our goal here at Magnolia Psych is to help you through whatever it is that is happening in your life that you'd like to change as fast yet as thoroughly as possible. So we're a group that really works hard to get at the root of what's going on and to help you change that so that you'll not need to get it fixed again. So we'd love to see you again, but we're sort of working to make ourselves obsolete. So let me tell you a little bit about, now that I've told you why you might seek therapy, let's think for a minute about what therapy might be like. So some of the things I didn't mention, sometimes people seek therapy for addiction struggles, or if there's been a past trauma in their life they might need to or want to work through, or just going through life transitions and wanting an extra hand with that. So what does therapy look like? It depends on the therapist, but here at Magnolia Psych, we all are striving for very open, which we call in therapy language, transparent work, where we let you know why we're doing, what we're thinking, and working together with you and us, both holding the steering wheel. You know, like sort of one of those cars where you're learning how to drive and each person has a steering wheel and we also both have brakes. So we work together. If you need to slow things down, you got brakes. If we feel like things need to slow down, we've got brakes. But we're also both steering. We're side by side in this together. We've all here at Magnolia been doing this for a little while now, and we're pretty good at connecting with people. And through that connection is how we feel the therapeutic alliance, we call it, grows. And then we can help you accomplish your goals. So we see people that are struggling with addiction, substance abuse, different types of addiction, trauma history, as I said, life transitions, somebody that wants to do some self-growth in any area. There's a wide variety of reasons that we see people. We help people here with social skills groups. So if you come to individual therapy, this is what it'll feel like, or look like, I should say. You sit down with us in our space, which we hope to make as inviting and comfortable as possible, and it's private and it's quiet, and that time, probably usually 50 minutes, is all for you, where we dedicate our attention to you and our time to you. We look at you and we focus and we work to make a plan and to get you where you want to be emotionally and behaviorally, if that's an important aspect for you. And then, so at the end of the 50 minutes, we make it time to meet again, whether that's in a week or a few weeks or a month, or maybe you got everything figured out pretty quickly, although it does usually take a few sessions or a few months at times to work through things. It depends on how you're feeling, what your goals are, and what the severity of the feelings or symptoms that you're having. So that's what it looks like if you have an individual session. If you come here and you're interested in group therapy, which I'm going to do a whole separate video about group therapy, but I want to quickly say, whoops, look at the bangs all over the place, that if you're interested in coming for group therapy, you'll meet with us one-on-one first, and we'll make sure that you are a good fit for the group. We like our groups to really work together well, so we are thoughtful about how the groups are put together and whether this group might be right or a different group. When you come for group therapy, you sit in a circle, and it is a little bit like the shows you may have seen about group therapy, but also a lot different. There's a lot of meaningful change that happens in groups, and again, I'll talk about that in another video, but you would come in same as you would for individual. We'll talk all about how that will be and look for you and what you can expect. So in therapy, we do expect people to give a lot of themselves, meaning you have to be kind of willing to dig around and see what's really going on and let us come along for the ride. We'll go as fast or as slow as you like. Sometimes we do slow things down if we feel like we're going too fast, and sometimes we do push a little that gas pedal to speed things up to what we feel like you can handle. You're always right there telling us what feels comfortable, what feels right. And then we start working through things that you might have felt for a long time, things that might be new thoughts, but we work through them together in a loving way and help you get to the place that you'd like to be. Again, emotionally, behavioral, or cognitively, meaning the thoughts that you're having. We usually work on all three of those areas to help you live the best life that you can possibly live. And we're all very positive here. We believe that there's nothing that we can't talk through. We can't make some kind of work together. So that's how the therapy works. And then there are times, it's important to say as well, that you can feel a little bit worse before you feel better. That's actually how you know that you're doing some good work, right? When you make change in your life, everything wants to kind of go to status quo, whether it's family or the way you've been before, and working, past that sort of what we call over the hump, or what I call over the hump, working past that can lead to some struggle, and there can be a period of time where it feels like, oh, things are actually not that great. Well, that's because you're making change and you're working through things, and we just keep going, and then pretty soon, quickly, people say, oh, I think I'm over the hump and I feel pretty good. Now I'm just working on maintenance or how I want things to look from here. I've never been on this side of the world in myself, emotionally speaking. So I'm going to try this out, see what it's like, and we can be right here with you working through that. That's how therapy, on a very broad and quick overview, can be and look and feel. And we here at Magnolia want to be with you in that process and work through it with you. If you're interested in working with us, or if you're interested in working with any therapist, here are some things you can do to try to find a good fit, because that fit is very important. It's a relationship like any other. When you're out there in the world, if you're looking for a therapist, there's several websites. Psychology Today is a great website you could use. Look for therapists. It doesn't have to be just psychologists. Every therapist can be on there. And you read about how they write. Do you like the way they write? Do you like their style? Read through the websites. Read how people describe their work. See if you like it. See if what you're experiencing is a match for the type of work that they do. And then meet with them. You can meet with them once and never go back. That's totally fine. Meet with them. See if you like them. And if it feels like a good fit and that you feel ready to do the work, then give it a go. Make that commitment to yourself and get started. I'm going to make another video more lengthy about how to find a therapist, but for now, that's a pretty good start. You can just start looking out there, and Psychology Today is a great place to start. So if you ever need anything, you can reach out to us. We're here for you. If you're in the Mount Pleasant area in South Carolina, which is where we are, we're pretty happy to be here in this beautiful part of the country. Go ahead, look on our website, find somebody you think might be a good fit, and then you can make an appointment online, and we'll be ready to welcome you here to our offices. Have a great day, and we look forward to meeting with you soon. Now I just have to find the stop button.